Good evening, William and Mary. Thank you for joining us for the first community conversation of the semester. Many of you will remember this format, but I'll start with a quick refresher for those who are new. We launched these conversations in March of 2020, a long time ago, as a way to share pandemic experiences of students and faculty and staff, of families and of neighbors and alumni, and as a way to answer the most frequently asked questions at any given moment. These turned out to be one of the most positive innovations that we have come to under pandemic and that we want to carry forward. So I'm going to kick things off by welcoming all the new students, the new staff and faculty, the new families. William & Mary is concluding the second week of predominantly in-person classes. And for those who haven't been on campus, it has been a wet and sticky 2 weeks with storms blowing through every 2 or 3 days. We have convocation finally tomorrow evening. If all goes well, it's supposed to be really, really beautiful. Third time's the charm. All new students from the past 18 months, that's 4 cohorts, are going to be cheered as they walk through the Wren building. That's 4,000 students who joined us since 2020. It's going to be so joyful. We're also continuing to adapt and protect the health of our students, our staff, our faculty, and our neighbors, and that's the topic of tonight's conversation. But before we get to that, I want to add that this is a solemn week as well. Saturday, as everyone knows, marks the 20th anniversary of the 9/11 terrorist attacks, and anyone who was an adult on that morning remembers it very, very vividly. As a university, William & Mary will come together to honor the lives of those that were taken that day. That includes 7 William & Mary alumni. I'd also add that all of us are heartily sick of pandemic. Many of us are carrying concerns for children and vulnerable loved ones. Many have lost people who are dear to them. If anyone listening is a first responder or a physician, a healthcare professional, thank you for all the work that you've done over the last 19 months to help keep our communities safe. And for the rest of us, it's really critical this fall that we remember that in combating pandemic, which is our common enemy, the rest of us have a key role too, which is to flatten the curve again. So I'm bringing that idea of flattening the curve back into conversation. I know our epidemiologists will like that. It's not about politics to talk about flattening the curve. It's about respect for one another and commitment to one another's health as members of this community. So right now, all of us are still in the process of discovering how to live, how to work, and learn in person in a pandemic that's still evolving. There is so much uncertainty still, and we're all learning together. William & Mary's adaptations are based on what we know now, and those adaptations look different because we know so much more than we did a year ago. We've seen the ways that our community has persevered and the grit and care for others that everyone here can bring to the challenges that we face. We have a lot more tools now. I'm thinking of the community conversation last spring in which we spoke with a number of alumni who were involved in developing testing and developing the vaccines that sit on 10 years of primary medical research. And just last month, we saw full FDA approval of the Pfizer vaccine with others to come. We know that these vaccines work significantly to reduce the severity of COVID-19. We know a lot more about how the virus is spread and the importance of mask wearing critically, especially in areas of high transmission. I just want to add one more core commitment of William & Mary's COVID-19 response, and that is that we share as much information as we can, as transparently as we can. That's one of the reasons for these conversations. We're committed to sharing the facts as we know them as a public good. And what I mean by that is that factual information is a public good because with accurate information, the whole community can make sound decisions for yourselves and for each other. Now, we've been hearing a lot of questions about the data that we're seeing, about new variants, and how the science is guiding William & Mary's decision-making. And our goal for tonight is to let you hear directly from the experts who are working with this data on a daily basis and making recommendations to the senior leadership team and to me. I'm really grateful to be joined by members of William & Mary's multidisciplinary public health advisory team, name of PHAT, P-H-A-T. For those of you who may be new, this is a team of domain experts, university physicians, and public health scholars The group meets weekly to dig into the latest data and trends locally and nationally. And we're so fortunate to have their work and their expertise on behalf of this community. Joining us this evening are our Chief Operating Officer, Amy Sebring, who is the chair of FAT. Many of you will know her from her weekly CRT update emails every Tuesday. You can just wave. Health Sciences Professor and Epidemiologist, Dr. Carrie Dolan, who's also the parent of a national finalist baseball player. So you can send her kudos through the ether. And Dr. David Davashy, Medical Director and Staff Physician for the Student Health Center, who is also a parent with a third grader, and they're on the same timeline, being back in school with William and Mary. Welcome, everybody. Thank you for being here. So I'm going to kick us off with just the basics, what we know now. And maybe Ms. Sebring, you can start with what is the current positivity rate on campus? What patterns of transmission are we seeing?
Happy to do that, President Rowe. And I would add, I'm the parent of 2 college-age students.
Yes.
So I also am experiencing what it's like to be in the midst of a pandemic from a college perspective with my 2 sons as well. So the data, we just actually updated the dashboard in the last half hour or so. We have a dashboard on our website that we update daily, Monday through Friday, except for holidays. So if anybody's out there looking tonight, you'll see that we currently have 158 active student cases and 3 active employee cases. As we talk through this evening, it's, I think, important for context. Friday, a week ago, September 3rd, we were at 11 active student cases. And so part of the activity that you've seen this week and our responses this week have really been a reflection, not in so much of the order of magnitude of the cases, but the rapid pace with which we were seeing spread really over the last several days.
Thanks. So Dr. Dolan, why don't you jump in and talk a little bit about where we're seeing COVID-19 spread on campus, because I think that's probably one of the most interesting questions and the most frequently asked ones.
Sure. So we are doing a deep dive into that data every single day and sometimes multiple times a day. And we're looking for patterns. And when we see something, we're asking very targeted questions to understand what's really going on. Because we are spending such a lot of time with the data, I can confidently say that we know that the spread is occurring in areas where people are not wearing their masks, largely in areas that don't have good ventilation, so inside, in areas where people are consistently wearing masks and where they are using them correctly. We're seeing very, very low transmission. So in our correspondence this week, we have mentioned a couple of times that we're seeing low spread within the classroom setting. And the reason that we are saying that and the reason that we know that is because people are correctly wearing their masks and consistently wearing their masks. And we're not seeing patterns of transmission just yet. I get a lot of questions about that. And the example that I like to give is the hospital setting. So in a hospital setting, you can see a lot of cases happening, but transmission is actually really, really low. And it's low because people are consistently using universal precautions. We're seeing that on campus in our classrooms as well. We have great adherence, and we've done a study with the CDC looking at the adherence of our students, and they're exceptional with wearing masks and following those protocols. We have tools that work. We know that vaccines work. We know that these masks work. We know that ventilation works, and then when people can distance, that's a good thing too. And that's consistent with the CDC guidance that says the same thing. As a corollary, Dr. Wells, or one of our FAT physicians, will say vaccines aren't a suit of armor. So it's not just we get these shots and then we can march along. There was a little bit of time this summer where we thought we might be done with all of the other interventions, but we're not. We need the vaccines. We also need the masks. We have lots of tools. We know what works. We just need to use them.
So you've said something that was reassuring to me about a week ago, which is we should expect the public health landscape is going to look different in 2021 than it did in 2020. We are seeing those differences. Can you talk a little bit more about those differences as you think of them as an epidemiologist?
Yeah, so 2021 pandemic is extremely different for me than 2020. In 2020, we had very little data, we had very little science. I was out in my garage spraying my groceries with Lysol. I was going around with Lysol wipes, wiping the door handles, afraid that I was going to give something to my mom or my dad, and then there would be some sort of negative health outcome. We now confidently know we don't have to do that stuff anymore. That's not how COVID is transmitted. And so I feel really confident in where we've come and how we've evolved and the information we have, and that we are building policies on solid data and solid science. So a couple of the things that we know work. We know that those vaccines work. We know that wearing masks work. We have some pre-Delta data that shows us that if two people are sitting next to each other and both of them are wearing masks in a classroom setting, the risk of transmission is less than 1%. And so that's a pretty powerful information for me to think about as we're learning and responding to the Delta variant. I want people to know that we have tools, we know how to use them, and we're working together to do our next best steps based on information that we've had from before.
That's great. It's striking to me that those were pre-Delta studies, but they were also pre-vaccine studies.
Correct.
So the sequence you've taught us is what works in order is vaccines, masking, ventilation, and distance where possible.
Correct.
Okay.
And we need to understand we can't always do all these things at the same time, but we can have a phased approach, and the phased approach is important. I think people need to know that we have a number of policy levers that we can pull, and President Rowe just outlined several of those strategies, but it's important that we're applying them consistently and that we're working together to do them correctly.
Thanks. I'm going to ask Dr. Dafaji to jump in and just say, again, really concretely, what symptoms are we seeing among those who are having breakthrough cases on campus?
Yeah, well, so fortunately, most of our individuals that we're seeing in the clinic and people who are symptomatic are having very mild symptoms. So typical URI symptoms, the common cold, so cough, low-grade fever, runny nose, sneezing. We're really seeing very minimal symptoms for the most part. And I would attribute that to a couple of factors. Certainly one of them being that, the student body for the most part is young, healthy, and relatively low risk. But it's definitely in no small part to the phenomenal level of vaccination that we're seeing on this campus. And we have, 93% of the students are vaccinated, fully 90% of faculty and staff are vaccinated. And we expect those numbers to only increase in the next week or so. So we are dramatically more vaccinated than the general population. And I think it's important to remember, as Professor Dolan mentioned, the vaccine is not a suit of armor. And we do know that with the Delta variant, the vaccine is somewhat less effective at preventing infection. But what it's great at doing is reducing morbidity and the severity of symptoms. And so our highly vaccinated population, I think, is a large reason why a lot of people just aren't feeling that ill. So we're very pleased with that, and we're nonetheless recommending whether you're faculty or student that even mild or moderate symptoms be checked out in a timely way. Because we do know that identifying these cases in a timely way is one of the best ways to try to mitigate the spread.
Okay, I'm going to come back to that in just a second, because I heard you say earlier, if you've got a sniffle, just assume it's COVID first, and you can go through the sequence of things that you need to do. I thought that was great advice, but I don't want you to do that one quite yet, because we're still doing scene setting at this point. I think our number is 96% students vaccinated for those who are living and learning on campus, which is, I think that's what I heard from Ms. Sebring earlier on. Is that right?
That's correct. So the 93% is when you look at the entire student population, some of whom are fully online because they're taking some of our online programs, but 96% for those that are actually in the campus area.
So that's my setup for the question for you, Ms. Sebring, which is, given that number, why did we decide to require masks outdoors? Why was that recommendation one? I can tell you why I accepted it, but I want to hear why you guys recommend it.
And as you can imagine, we've gotten a lot of questions about that. Certainly, I think as we established going into the semester, we knew we were going to require masks indoors. And as Dr. Dolan walked through with us, vaccinations, masking, ventilation, and then distancing in that order are really the tools that we have found to be most effective. The change that occurred really for us over the last week was, again, looking at the pace of spread. We were seeing cases increase tenfold in a week. And although the numbers still remain relatively small, to think about a multiplier effect over multiple weeks, we really didn't want to put the campus in jeopardy, and are committed to making sure that we're staying in person and being able to bring the community together in the ways that we know are so important. Outdoors are a little trickier, admittedly, and so the guidance that we've provided is that masks are required outdoors unless you can maintain physical distance. So there are a lot of opportunities, a student studying in the sunken garden without any other students around them certainly doesn't need to have a mask on, and we just need to be really thoughtful and deliberate in how we're making those decisions. One of the best things we did last year was to establish a culture of masking. And in times of high transmission, masking is going to be really, really important for us. And we're likely to see episodes of spread throughout the rest of this academic year.
Yep. Thanks. I would just add a couple of things for everybody to remember, that not everybody in our community has been able to complete their full round of vaccines, and we won't expect that until the end of this month, and develop that resistance to the more severe forms of the illness. And some people can't get vaccinated, including children of employees. And so we're taking this step now in order to really stop transmission in its tracks and reset. And it's proven very, very effective in the past in doing that. So I think that's the key set of questions about where we are now. I'll just recommend to all the students, staff, and faculty out there, eat outdoors, right? Party outdoors. Remember that not everybody in our community has that wonderful, very high rate of vaccination. So all of us move through the world in communities that aren't vaccinated at that rate. And we have to be cognizant, as Ms. Sebring said, of the need to be wearing masks when we do. So Amy, maybe this is a question for you. Really common issue that people who are trying to think through what's coming next raise with us is whether we have a threshold of some particular number, whether there's a tipping point of some particular stat at which William and Mary will revert to all remote learning. So can you talk us through how you respond to that?
Sure, I'm happy to, and I'll invite my colleagues from the public health team to chime in. They will attest early on in this pandemic, I kept asking, what's the number?
Right.
Because I wanted that certainty, right? I mean, I think we all do. And what we've really recognized is that there is no one specific number. There are a number of data points that the public health advisory team is monitoring routinely for us. As I mentioned, pace of spread is an important one. And that's why you saw us come out with some additional recommendations this week. But I think the concern is, will the university revert to remote learning? And we are not intending to do that. There may be points along the way where we're having to make modifications in how we're operating, but we really remain committed to in-person instruction because it's been clear to us that that's what our students want and crave. And it's really important for ensuring that they are getting the best learning outcomes.
That's been amply evident. And I think it's worth remembering, all of us, that the thing that should be keeping us up at night right now is learning loss. For every age group, for every cohort, they have been living through really serious disruptions to their learning. So the more stable that we can make it over the long run, the better. So I'm going to switch to testing and case management, because a lot of questions have come in from that moment when you find that you've got a cough or a sniffle. And I'm going to start with Ms. Sebring, with you. What should somebody do? What should a student do or employee do if they think they have COVID symptoms,
Sure.
especially on the weekend?
Right. And Dr. Dafashi, I may need your help on weekends because I know you are often on call. But certainly, if a student, faculty, or staff member is really experiencing emergency symptoms, they should call 911. But as Dr. Dafashi said, what we're seeing in our students, which is where we're seeing COVID really present itself right now, We are seeing students who are symptomatic, but they are mildly symptomatic. If you're a student and you're not feeling well, if you're wondering, is it allergies, is it a cold, you should contact the Student Health Center for an evaluation. They can help you walk through that and evaluate whether or not you should be tested for COVID. On the weekends, we have after-hour medical resources that you can find on Path Forward. And again, Student Health Center can also provide information on how to get in touch over the weekend if you need consultation. For symptomatic employees, you should consult with your physicians or a provider in the community that can help, as the Student Health Center does for students, establish whether or not you should be tested for COVID. And then for asymptomatic individuals, this is the question I get the most, is how can I get tested if I've been in close contact with a known positive? William & Mary is providing tests for any known close contacts. Part of our system is, if you believe you've been in close contact, report covid.wm.edu. You fill out that form, you'll be assigned a case manager. The case manager will reach out, walk through with you, or give you information around what it means to be a close contact and validate that you in fact have been a close contact. I will say having your roommates, boyfriends, best friend be positive doesn't necessarily mean you're a close contact if you actually haven't been in close proximity with them. So we have guides to help students understand that. You shouldn't feel like you have to navigate that on yourself. But if you've been in close contact, William & Mary is providing testing at the right time to verify whether or not you in fact are COVID positive. And I'll underscore at the right time. I know, I've been in close contact and it's an anxious moment because you want to know immediately what your status is. In fact, CDC recommends that if you're vaccinated, that the appropriate time to test is 3 to 5 days after exposure. If you've been unvaccinated, it's 5 to 7 days. And so again, the case manager will work with you to make sure that you understand and they understand when your exposure likely was and time the testing for you appropriately. I'll also say for our employees, the same applies. We're not doing testing because we don't have a health center on campus for employees. We're not doing testing if you're symptomatic, but if you believe you've been in close contact on campus, again, a case manager will reach out to you and provide you with testing at the appropriate time.
So that was a lot, and it was really critical information. The number one thing is if you are symptomatic or if you believe you've been in close contact, log it in report COVID, because what will happen then is we'll assign you a case manager who will be able to evaluate whether you are indeed a close contact. And that's a technical assessment. It's not something that happens casually by a layperson like any of us. It's a trained process. And then let's say you are identified as a close contact, put your mask on and be very cognizant of keeping distance and keeping mask on around other people, because it may be several days before a test can be determinative. So that the impulse is, especially with another thing that's new, Dr. Dolan, is that we have rapid tests that we can buy at CVS ourselves, but those are going to give us inaccurate information if we use them at the wrong time. So you could put yourself in a worse position if you haven't actually had an assessment by somebody who can think with you when was the potential exposure and when is the testing going to be effective. So I've jumped ahead, Dr. Daffy. I was going to ask you to walk through how do we do the testing? What's our capacity? What happens when somebody comes in to be tested?
Great. So, and I think Amy has kind of touched on a lot of this. So if I'm replicating things, I apologize. But yeah, right now, as Amy pointed out, we are focusing on two groups of individuals, right? So symptomatic individuals and people who believe they may have been a close contact of a positive case. How we're operating, we're seeing the symptomatic students, and again, no symptom is too small. I mean, even if you just have a runny nose or a sneeze that you can't otherwise explain, we would highly encourage you to come and make an appointment with us. We're here for you, and that's why we exist. We are currently doing rapid antigen tests because in symptomatic people, that is the most desirable one. In asymptomatic close contacts, the PCR is a preferred test. So what we're basically doing now is we're testing a large number of people. We have had a large number of positives. And then we basically ask them to report covid.wm.edu, as they pointed out, And they too will be connected with a case manager. And we recognize that COVID is more than just, concern about your health and how you're feeling physically. It really impacts every realm of your existence, right? So it means, you won't be able to attend classes for a chunk of time. There may be some financial hardship involved in finding a place to stay. So the case managers are just a wonderful resource. They will reach out to that positive individual and they will walk them through and basically be their guide through their isolation period. Determine if perhaps isolating locally is the best option, or if perhaps going home would be a preferred option for that individual. So they will determine where they're going to isolate and then proceed to help them with all the other aspects from classes and what have you, just so the experience is one that is hopefully a positive one for students. We know it's a difficult time for them, and the case managers are really there to help them navigate that. The Student Health Center is also a phone call away, and we highly encourage students to call us. There's no question too small. We're there for you, and we love answering questions. That's why we exist. So don't ever feel like you can't just pick up the phone and say, hey, I'm not sure about this symptom. What should I do? So.
Thank you. I'm going to flag a couple of things there. One is people's privacy, which matters a lot. That William & Mary does not identify the names of people who have contracted COVID-19 publicly or to the greater campus community. That is one of our commitments that we take very, very seriously. A second is that we are testing employees who are unable to be vaccinated weekly. So there's a third group that we're regularly testing, and that we have a range of other kinds of testing that we can bring into play when we think it makes sense, that remain available and that we're very practiced in from last year. I think we talked a little bit about why following the William & Mary process for testing and reporting and case management matters so much. And we talked a little bit about how tempting it is to just because we're worried, freelance a solution for ourselves. Can you talk a little bit about the negative impact of that kind of freelancing when people go and test themselves immediately, Amy?
So a couple of things impacting, really thinking through what we saw some activity this weekend, which were students were anxious, concerned, understandably, and trying to find tests on their own, be that either, an over-the-counter drugstore test that they were administering or trying to go into one of our urgent care settings in the community. I think, as I mentioned, they actually may have been testing at the wrong time. So they may have gotten information back that actually isn't going to be good data for them and really understanding what their status is relative to COVID. And for those in the community, if you're testing at the wrong time, you're essentially using two tests, because you have to test, you're testing initially, perhaps prematurely, and then when you actually get into the time period that CDC recognizes, tests are likely to be most accurate. And so at a time when people are looking for tests, one of the negative consequences is that you actually could be using a test that really somebody who actually is symptomatic or is in the period of testing time really needs more immediately than you.
And I just want to say really directly to students, one of the most important things to remember is that you should not feel like you have to navigate COVID-19 on your own. We have resources for you. They're robust. And we have amazing case managers who are trained to help you determine who might be your close contacts, whether you've had any, and when you need to test. So we can take that uncertainty away from you really easily and make it just much less challenging and emotionally fraught to manage living with the prospect of, do I have COVID now? How can I know? So you're not on your own.
President Rowe, I would just add, reportcovid.wm.edu is the way that we know, right?
That's right.
That's the
right.
fastest way.
That's how we marshal that phalanx of people to support. So really good to double message. What were you going to say, Dr. Dafshy?
I was going to say, at the risk of sounding too repetitive, I just like to say one more time, you guys, you obviously highlighted it very, very well. But if you are a close contact, remember most of you are vaccinated. Do not panic. Do not worry. Continue to be vigilant and test on day 3 to day 5. Do not test sooner than that, right? Unless significant symptoms develop. but test on day 3 to 5, not sooner. We see that happening over and over again. And not only, like you said, is it not helpful, it can actually be damaging by creating that false sense of security and wasting resources. So day 3 to day 5 is the magic number.
For families that are new, I think there's something pretty amazing about William and Mary students that you should know. Before we came back to campus in person last year, we surveyed the students on what were the things that they were most worried about. And the number one worry was that I will get somebody else sick. The second worry was that I will get sick. And that's, I think, one of the really powerful qualities of the unique students that come here. They care enormously about protecting their community. That's why we have been so successful with things like mask wearing. And it's why we owe a great debt of gratitude and pride in our students for the way that they've navigated these constantly changing challenges. So the really interesting thing, not a single one of you has said the word quarantine. So I'm going to ask Ms. Sebring, Amy, would you come to the question that a number of families have asked about, which is our decision to use hotels for isolation. What's the deal with quarantine? And why did we come to that decision? Can you talk through the thinking process?
Sure. So a couple of things I think as we realized and as the CDC guidelines evolved, if you were in close contact last academic year, you had to quarantine, and you had to quarantine, wait to be tested, determine whether or not you were positive. And if you were positive, you then had to isolate. And so actually for many of our students, it turned into a pretty long, prolonged, sometimes 17 or 18-day experience if they had to quarantine and then isolate. The CDC changed its guidance when vaccines became available. They essentially said you don't need to quarantine if you are close contact. And so knowing that we have a highly vaccinated population, our need for quarantine space this year is much, much diminished. For our unvaccinated students, and we recognize that there are still some who are unvaccinated with appropriate medical or religious exemptions. They still need to quarantine, but for the vast majority of our students, quarantining is not part of what we're having to deal with this year, gratefully. And so that was really one of the factors as we started to think through what would isolation space need to look like this year. The other thing that we found last year is that most of our students really prefer to be at home, both for their physical well-being and their mental health. Going through an isolation period at home really was the preferred option for many of our students if they could do that. And so, we made that decision this year that we would be encouraging students to isolate at home if they could, that we wanted them to have a plan, to be thoughtful with their families about how that would work. And then, lastly, we do recognize that not everybody can get home. Out-of-state students may not be able to travel home. There may be some that have circumstances at home where actually isolating at home isn't their best course. And so we've negotiated with some of our local hotel partners to try to get as favorable rates as we can, and really make sure that there's availability in hotels in the area if that's what a student needs as their isolation plan. We also recognize that even for students who have the ability, want to go home, that they may need a day or two, while they wait for mom or dad to come pick them up, or while they get things settled at home. And so wanted to make sure that we're providing any student that needs it up to 2 nights with the university paying for those 2 nights in a hotel if they need that bridge time. And then lastly, Dr. Dafashi, I heard you say, and I know you and I have had a number of conversations, not every student has the financial means if they need to isolate locally. 10 days at a hotel can be a pretty daunting prospect. And so the university has part funds. And part of what a case manager does is work with that student to understand if there's a financial need and to get resources to the student if they need them. And then lastly, we continue to update information, but for students that are on meal plans, working with William and Mary Dining to have meals delivered at the hotels if you want to choose that as the way that you're getting meals during your isolation period.
Thanks. I'm going to shift to the academic side of things just for in closing, because I know we're getting close to time here. And Dr. Dolan, I hope you'll echo what I have to say about that. I'm speaking as somebody who taught for 25 years and then was a dean and a provost. And And many students and many faculty have come together to come up with resourceful solutions for dealing with the absences that students may have because they're sick. We would do that normally in any circumstance, but COVID's a little different. And so I think the question families often have is, how will faculty accommodate students who have to isolate for a slightly longer period of time for COVID-19? And the answer is that our deans and chairs are going to work with the faculty to think through what are the best options for the students who are out and for the class as a whole. From the beginning, William & Mary has been successful because we've asked faculty to ensure that students get the support they need to stay on track to their degrees. And we've trusted our faculty, their expertise, their understanding of their students in their class to ensure that the students do stay on track. So for all the students and parents, I want you to hear me saying this and encourage this as well. If you are worried about that, reach out to your faculty member and know that they will be there to think creatively with you about what's the best way to ensure that you stay on track. We don't have a one-size-fits-all answer because we trust our faculty to come up with the best one. Anything you would add, Dr. Dolan?
Yeah, I just wanted to add that we are a very strong and resilient community, and it is not a surprise that we have an increase in cases at the beginning of the year. We expected that, and I'm confident that we can work together to build a collaborative community and that we can move forward together in a way that makes sense.
Thanks. I heard you say that last week too, which was incredibly reassuring. We have seen a bubble at the beginning of every semester. So, and we've made adjustments every semester, the ones that are suited to that moment in time, and they've worked. So I feel the same confidence, and in part because we have the wisdom and the deep experience that the FAT team brings together. So thank all of you. Thank you. I'm going to thank everybody out in the ether too for sending in your questions. I think we hit on the major ones that we've been receiving. If you've got ones that we didn't touch on, send them in. Well, first thing I should say is go to our Healthy Together page and read it through. There is a lot of information there. It is accurate. It can be trusted to be updated. It's likely more accurate and more effective for you to use than what's on the web. And I would, besides what's on the web and social media, out in the press, right now, we're going to give you the latest data at our Healthy Together page. And I'd encourage you to use the COVID-19 response line to keep sending your questions in, because when we know the questions that you have, we can get you to the right people to answer them. So that's it for tonight. We'll see you at the next one. Until then, stay well, everybody.